Now we'll quickly move to the next aspect of cancer of the cervix, which we get to talk about the pathogenesis. So pathogenesis is more of like, okay, a disease condition exists, okay, but as a scientist now you want to actually know in depth, okay, to everything about this disease condition, step by step, to how this disease condition came to be, and all those information. So for cancer of the cervix, it's a multi-step process. So it's driven primarily by what? Infections from human papilloma virus that have been consistent. So the person have, a lot of women get infected by human papilloma virus, but not all show up with cervical cancer. So if you are repetitively being infected and your immune system is weak, is what actually favors the progression of the disease. So it involves a progression from normal cervical epithelium to precancerous lesions before the cancer even sets in. So it's something that if the woman is always going for checkups, it's something that they can always pick it up early on, and even treat. So the first thing that actually kickstart this process is infection from human papilloma virus. So the high risk type, especially the type 16 and 18. Do you understand? So it integrates into the DNA and it expresses the E6 and the E7. So this will now scatter the cell cycle that usually check to know when a cell should grow and when the cell should stop growing. So E6 will block what? P53, which is a gene that regulates growth, okay, and helps to regulate that, okay, this thing should grow, this thing should stop. E7 inactivate the RB, which controls what? The cell cycle progression. So all of this, because it's being the things that regulate are being inhibited, this will now lead to growth that is actually what? Unchecked. So that the checks and balance of the cell cycles are basically what? Evaded. So there's development of cervical intraplasial neoplasm, which goes from the stage 1, stage 2, stage 3. Then lastly, the stage 3 progresses to the real cancer. Do you understand? So contributing factors: if the person started having sex early, the person has a lot of sexual partners, the person's immune system is not strong, the person smokes, poor genital hygiene, So prevention is basically, have safe sex, regular cervical screening so that they can always pick it up at early stage. Then treatment: once you see any precancerous lesion, you can basically start treating immediately.